Everyone, I'm Desmond Swayne, the Member of Parliament for New Forest West, and I was fortunate enough to come first in the private member's ballot. And I've chosen a bill with a narrow scope, focusing on the first 1001 days, largely based on the campaigning that's been done by my former colleague, Andrea Leadsom, and her. I'm very, very grateful to her 1001 Days Foundation. It's a vitally important area of national life. So many problems arise from young infants not having crucial support in the first couple of years of life, and indeed the later stages of pregnancy. And it is a space that is filled by, I think, a fantastic programme at the moment. The Family Hubs and Healthy Babies programme. And this bill doesn't set out to replicate that. What it sets out is to protect it in statute, so that budgets don't get cut and it doesn't go the way that Sure Start did. By accident. So when priorities change. So that's the thrust of the bill, and I'm happy to hand over to Will.
Brilliant. Desmond, thank you very much. Good morning, everyone. Maria, if you can pull the slides forward. We are absolutely delighted that Sir Desmond has decided to choose babies for his #1 slot in the private members bill, which is like winning the lottery in terms of being an MP. We will have second reading on the 4th of September. Maria, if you can pull this forward, we'll
Yes,
talk about what the bill is actually going to do. It is designed to be a relatively simple bill with three elements.
So
I'll just pull it up so you can see it at the same time. So the first is a duty on the Secretary of State to assess the needs of infants, parents, carers, and prospective parents and carers. So that's all about a consultation with families. We're not going to be prescriptive about how often that is. That will all come later. But the assessment of need is the first element and really critical. The second is a duty on the Secretary of State to make provision for services. Again, it's not going to be prescriptive. That will come in secondary legislation and statutory guidance. But nevertheless, very important that element is there. And then the third is a duty on the Secretary of State to report to Parliament annually on the provision of services and then also on outcomes. Again, the detail of which would be set out at a later stage. So it's very much a three-stage bill with three duties on the Secretary of State. But the design is, and we have to be very careful with private members' bills because they are ultimately the Treasury will make a decision as to new burdens, but also additional cost. There is additional cost to all three elements. At the moment, it's certainly in the provision of services, it's largely programmatic. So it's very important that when we look at services, we've been very clear with the Department for Health and Social Care and the Department for Education that we are not looking for this bill to go beyond the current services being provided as part of the Best Start Family Hubs and the Healthy Babies programme. I think if we were to go any further than that, I think it's likely that we would fail to get Treasury support. I think it is challenging, even as it is. I'm pleased to say that we've been in quite protracted but ultimately successful conversation with Department for Health and Social Care and the Department for Education, and they have both given drafting authority. That in effect means that they've given us authority for government lawyers to support the actual drafting of the bill. So we're in a really good place. It doesn't guarantee that the government will ultimately support it, but it is a good signal. Maria, if you could move on to the next slide, please. So Desmond's asked us to support with the bill and the administration, but in terms of how your organisations can help, because we have to ensure that ahead of Friday the 4th of September, as much as we would love to have government support, we need to be prepared potentially for us not having government support. And that means we need to get around 100 to 150 MPs there on a Friday, which is a challenge. So there are 4 ways in which we would love it if you and your organisations could help us. The first is to write to your local member of parliament, ask them to attend the second reading on the 4th of September and support the bill. We've prepared on our website, there's a particular page which has templates, letters available, also digital assets as well. If you could announce your support for the bill, again, there's digital assets to support that. Mobilise your supporters, so people who are supporting your organisation, if you could encourage them to write to their MP to put as much gentle pressure on as we can to support the bill, but also attend on the 4th of September, that would be brilliant. And also, as far as you possibly can, spread the word. So share our intent behind the bill with partner organisations, your networks. The stronger the case behind this, the more likely it is that the government will ultimately support it and will get MPs there on the 4th of September to support the bill. I think in a nutshell, that is what the bill intent is. We'd be delighted to take any questions that you have on the specifics and in particular on how you may be able to support the bill ahead of second reading on the 4th of September. Maria, I might need you to facilitate this for me and see when hands go up.
Of course, let me just stop sharing my screen. Also, for everyone, we do have a Q&A in the chat in case you cannot ask your question by raising your hand, but all questions are welcome, and we are going to share these slides that you just saw with everyone, so you can contact us directly if you have any questions. We have a couple of hands going up. I'll give the word to Penny, if you're there. I'll just allow your mic, and now you can ask the question, I think. Let me know if...
Hi, thank you. I just wanted to ask, is maternal mental health focusing on those who have babies in neonatal units? Is that an aspect of the bill that's being looked into at all? Is that kind of maternal mental health covered?
So at the moment, it's envisaged to be the core services as provided as part of the Healthy Babies programme. So the DHSC and DFE core service provision. So there's perinatal and parental mental health support for mothers and fathers as part of that, but it's all through the Family Hubs programme. Does that answer your question, Penny?
Yes, it does. Thank you.
So in effect, it's the core offer, and that's important because what Sir Desmond is in effect asking the government to do is to, a duty on the Secretary of State to make provision for the services that is already being provided. The difference being that at the moment those services are programmatic, which means the Secretary of State has to in effect bid for those ahead of every spending review, as opposed to them being protected or enshrined in statute, which as much as it's possible to do, this legislation is designed to do.
Thank you.
Perfect. Thank you so much, Penny, for your question. Then we have Victoria. I think you can already open your mic and camera if you want.
Hello, thank you for your time this morning. I'm from Harry's Hydrocephalus Awareness Trust. One of our big focuses is on ensuring that babies are screened essentially for hydrocephalus through head measurements. I understand that that probably doesn't come under the current situation that is being offered through the Healthy Start programme. However, I just wanted to ask, because there's so many things that are happening in the sphere of baby health at the moment. You know, you've got the 1001 Critical Days Foundation, you've got the Babies Bill, you've got the Maternity Advisor and the Maternity Commissioner. What difference in practice is this going to make to families on the ground? What differences will they see?
It's a really good question, and you know, the work that you're doing is really important. I mean, in effect, all this bill, and I say all, does is seek to enshrine in law the existing services that are being provided for babies through the Best Start Family Hubs programme and Healthy Babies programme. Now, that doesn't mean that couldn't expand in the future, but what this does is put it on a statutory footing to ensure that it's not just programmatic. that it would actually be enshrined in law. It means that there'll be a duty for the Secretary of State to assess need. There'll be a duty to make provision for the services, and then the important bit, and of course the first two are important, but the accountability mechanism, which is why I stress it's important, is that the Secretary of State needs to report to Parliament annually on the delivery of services and outcomes. So it doesn't mean that in the future things can't get added to it. No doubt the provision of services will increase over time. I suspect in fact I know when the original Education Act came in, it didn't look anything like education that's currently being provided by statute. Things evolve over time, but this will be the first time that it's not just programmatic, but it would be enshrined in law, and I think that's why it's such an important first step. It means that we hope that for any future government coming in, this would just be seen as, well, this is just business as usual. This is just what government does. It's not discretionary. It's not something that's up for debate or question, and I think that would be the significant change.
I think that's amazing. I think it's so important that families do have that stability and they have that ongoing continuity. It's what a lot of families tell us that they struggle with. So I think we fully support this, and we think it's absolutely fantastic. And obviously, if there is scope in the future to develop, and add on things, we would be definitely interested in doing that. I don't know whether you probably are aware of the RCPCH's State of Child Health report that came out this week, obviously highlighting some quite worrying problems really in child health. And I think, that in itself is an indicator that we do need to probably add things to this. But I appreciate at the moment you have to focus on getting it through. But we really are keen to work with you on, adding anything that we can in terms of our value and our experience and lived experience to ensure that, that just develops in the future if possible.
Thank you, and I think you've really made a critical point that we've got to be, and we're deliberately being very careful. We can't make the perfect be the enemy of the good, and we know how far we can push the government. I think the risk is, and I've seen this so many times before, of bills that stay as bills and therefore end up really as just parliamentary graffiti. The key here is ensuring it becomes an act, and that means we do need to get ultimately in some way government support and treasury support. And there's a risk if we try and add too many things into the bill that it makes it so unpalatable to treasury that they just pull the plug. And that's why I say we've got to be so careful not to make the perfect be the enemy of the good. So it's a point really well made.
Yeah, of course, and thanks. Please do let us know if there's any way we can add to
Brilliant.
that in the future.
Thank you.
But if we can meet, I'll send you an email and potentially we can have a little meeting. That'd be great.
Thank you so much, Victoria, for that. The next one is Evan.
Evan, yeah, hello. Thank you so much. I'm Evan from NSPCC. Thanks for setting that out, and I completely agree. And we're really excited about the bill and everything you just said about how to sort of not make the perfect enemy of the good and get it to an act. We're really aligned with that. I'm thinking about the second sort of pillar though, in terms of the duty to make provision on services to the Secretary of State and sort of making sure it's not programmatic. And obviously you're talking about the services that already exist. You're talking about Best Start family hubs and Healthy Babies, but obviously in the context of Healthy Babies funding is only in 75 local areas. So it's not everywhere. So even though there's the principles and the requirements, the funding isn't across all areas. So I'm just wondering, being very mindful of everything you've said in terms of not putting too much into the bill and making it sort of palatable to government, is there a way that we can sort of address that within those confines? Or be interested to hear your thoughts.
Yeah, it's a really good question, and thank you and your organisation for all of your support for the bill. I mean, in effect, the duty to make provision for, and that's a technical legal term which we've been working on, and importantly to provide information and services, because the information is also very, very important to address need. The bill ahead of second reading will not itself prescribe services. What it will do is secure the principle and leaves the menu, if you like, to secondary legislation and guidance. So the idea is the existing Best Start family hubs and Healthy Babies programme already defines a really strong service set to build on. So things like the health visiting and healthy babies programme reviews, the as I mentioned earlier, the perinatal and parental mental health support for mums and dads, infant feeding support, including breastfeeding, parent relationship support, therapy, so much more. But we know that they're commissioned and delivered through the Best Start Family Hubs network and underpinned by the Healthy Babies programme and local authority public health commissioning. So there's lots to think about in secondary legislation, and of course by the voluntary sector, who play a really important role in Family Hub service delivery also. So this is exactly what we need to think about in terms of secondary legislation and statutory guidance. But for the bill itself, it is the broad principle of a duty on the Secretary of State ahead of second reading to make provision for. So it's more top level. Does that answer the question?
Yeah, that's really helpful. Thank you.
Perfect. And then we have Joe Davies.
Hi, I'm Jo from Wild Young Parents down in Cornwall, but also leading our national young parent network across all 4 nations of the UK. And I'm really interested in how the UNCRC, the Convention on the Rights of the Child, is going to be built into and how well it fits with the bill. And also in the first one where it says in consultation with families, is it too late to change it to in partnership with families? It would be really good to have a done with rather than done to kind of tone. And just children in our country, as you know, some of them are born where they're likely to have a shorter and a harder life than other children. So meeting their basic rights to life, to health, to play, to education, and to have their voice heard. I'm interested how that's built into how you're going to talk to MPs about this and into the text itself of the bill.
Yes, I mean the first aspect, I don't think we've got that far in terms of thinking, and in terms of keeping the bill as simple as possible, I'm not sure if that would be within the text, or we can speak to the drafters. In terms of the assessment, and it's a really good question, the bill in and of itself ahead of second reading shouldn't be prescriptive about what's assessed, because that sits more easily within, again, statutory guidance or secondary legislation. So it could, for example, include midwifery, health visiting, perinatal mental health, relationships, etc., etc. I think there are lots of different ways in which you could do it, but that would come later. I think at this stage it's the overarching broad duty on the Secretary of State without being prescriptive. So that is probably a discussion to have further down the line. Does that answer the question?
Yeah, are children's rights going to be explicitly written at this stage?
No, I don't.
Okay.
And I think because we need a really simple bill that has as short number of clauses as possible that just sets out those 3 duties. It doesn't mean I think other things can't be explored later in terms of secondary legislation that sits underneath it. But I think the simpler we make this, the better, and the more likely it is we'll be able to get government support and ultimately alongside that Treasury support.
Okay, thank you.
Perfect. Then we have Joe Farrington. Douglas.
Hi, thanks. Oh, my camera's not working. Thanks, Will and Sir Desmond, for bringing this group together. I'm Joe Farrington Douglas from the Health Equals Coalition campaign to improve the nation's health through cross-government action. That's been a mission that's been supported, at least in rhetoric, by successive governments, from levelling up health or the health mission, but often gets pushed aside because we know that joined up work is so difficult. So we're really pleased to see this bill coming forwards. We have a coalition of 100+ organisations and also over 100 MPs who are signed up to support us. So we really hope that we can mobilise them to support this. My question to you, Will, and for the foundation is: do you have evidence of the benefits of this legislation for improving health and reducing inequalities for parents and future generations? Because a briefing or social assets that focused on those benefits would really help us to be able to mobilise our coalition.
So it's a really good question. So we don't at the moment know, and I suspect that's because what we're in effect seeking to do is enshrine in law what's already being provided through the Best Start Family Hubs and Healthy Babies programme, both of which are, have been and continue to be evaluated. But I think any support that you can give in terms of helping to make the case, I think would be hugely welcome, especially given your considerable network of MPs and supporters.
Yeah, I think that's probably something that we can look into. Sorry, I don't got my camera working. That we can look into, as there is so much evaluation and evidence around Sure Start. So I think if we could bring that together, then that would really strengthen the case, and then hopefully we can bring that coalition of support behind this legislation. So good luck with it.
Really. Now we have Emily Hackett.
Hi, good morning, everyone. Lovely to meet you. I'm Emily. I'm an advisor at the Local Government Association, and we are strong supporters of the ambition behind this bill, so really welcome it. Thank you. I've just got a quick question, and given the ambition is to protect this support from shifting political priorities and budgets over time, how does the bill's drafting guard against future erosion, particularly given it will rely heavily on secondary legislation for the implementation detail? Thank you.
That's a really good techie question, which I love, and the answer is we haven't got there yet. So we've literally just got drafting authority from the Department of Health and Social Care and Department of Education. We have a really tight time frame because we need really it to go to government right round by middle of August at the latest, given that it's the 4th of September, and in the middle of that we've got a new Prime Minister and potentially, well, definitely early next week, a new suite of ministers. So it certainly presents us some challenges, but you're absolutely right. We want to make sure, and Sir Desmond's been really clear on this, that we make sure that the bill is drafted so it has as much bite as possible. So we make sure that we're able to, the bill through statutes is able to hold the government of the day to account as much as possible. And then the key is that third strand also. So yes, you've got the second strand, which is the making provision for, but the third strand, which is the accountability mechanism, having to come to Parliament every year and account for the delivery of services, but also the outcomes, is going to be key in terms of the visibility. But you're absolutely right. We've got to make sure, given the provision and ultimate commissioning of services is often done by local government, that we've got to make sure that it's not just passed down and that the funding follows also. So we'll gladly work with you at the drafting stage to make sure that it has as much bite as possible, as we can, working with the government while still making sure that we can get it through Treasury.
Thank you, and we're really keen to engage as this progresses, so thanks very much.
Thank you. I might read 2 questions that are in the Q&A box and then leave the space for the rest of the people to ask. But Mike is wondering how the bill interacts or affects the work of healthcare professionals, especially midwives and maternity support workers.
It's a good question. I probably need a bit more context, and Desmond, I would need to think about that, because it is very strictly, or will be very strictly, defined in secondary legislation as to the current services being provided as part of the Healthy Babies programme as it stands today. So there is inevitably interaction with health visiting as part of the Healthy Babies programme, but that might be one for us to take offline and get the context, and we can look into it a bit further.
Perfect. And then Isabella James is asking if we are aware of how the needs will be assessed, and if there's a consideration for significant local variation in the services provided.
Yes, that's right, and that is at the moment all up for discussion. That again would be in statutory guidance and secondary legislation. So we will have that conversation down the line. And for second reading, it's more about the duty on the Secretary of State to assess. We also aren't settled, and we'll need to speak to the government about how frequent the assessment is also, whether that's local, national, regional. I think those are all up for discussion.
Perfect. And just conscious of time, because we don't want to take a lot more of Sir Desmond's time, but we have Eileen.
Hi there, Eileen Perrins from the Institute of Health Visiting. Just to say the IHV is fully supportive of the bill. Babies need protecting, and so a legal bill for them is very important. Alongside setting out statutory responsibility for healthy babies and family hubs, the bill needs to extend beyond the Department for Education and include statutory responsibilities to deliver the Healthy Child Programme and health visiting from the Department of Health and Social Care. Is it intended to cover this?
Oh, I didn't. I only caught the back end of your question. Sorry. Would you mind repeating that again, Lani? Would you?
Yeah, no problem. So alongside setting out statutory responsibilities for healthy babies and family hubs, the bill needs to extend beyond the Department for Education and include statutory responsibilities to deliver the Healthy Child Programme and health visiting from the Department of Health and Social Care. Is that intended to be covered?
Let's take that offline. I mean, in effect, the DHSC are leading on the drafting, not DFE. Which I suspect is a helpful sign, but let's pick up offline and we can delve into that a bit deeper.
Awesome. Thank you very much, Will.
Perfect. And maybe 2 more questions. Can we have Kat Evans? Yes.
Thanks ever so much. And Sir Desmond and Will, my goodness, thank you ever so much. As a Director of Children's Nursing over in Barts Health, very sadly, we see the impact on babies when they are not supported. So this is so appreciated, whether that be sudden unexpected death in infancy, whether it be lack of vaccination uptake. And as Eileen has highlighted, the critical element of making statutory services available and confirmed, such as health visiting, is absolutely essential. So I suppose my query is, in terms of professional support, you've clearly got the Institute of Health Visiting, but I'd be really keen that we also get the backing of the Association of British Paediatric Nurses, really backing and supporting this. So I just wanted to call out our sincere thanks for this work. It's really needed.
It's really kind, Kath. Thank you. Thank you for all your support.
Yeah, and maybe we can have Mike and Josie ask their questions, and then we can answer the 2 together. So Mike, please.
Thank you very much. Mike Hobday from the British Deaf Association, and real thanks to Sir Desmond and to Will for all the hard work on this. We're very interested in promoting the bill with our sort of parliamentary contacts and supporters around the country. We obviously want to provide the strongest argument about why they should be interested and involved. So it'd be really helpful to understand, I suppose, in respect of our concern that deaf babies are overwhelmingly born to hearing families who don't have a good understanding from the start about the language support that they can give to their babies. How might this change, or how might the bill move us in the right direction so that needs are understood and support can start to be put in place?
Thank you so much. And then Josie, if you can come to you next, please.
Hello, my name's Josie. I work for an organisation called Bliss, who support babies when they're born premature sick. So thank you so much for this really helpful presentation. I completely understand and appreciate that the priority right now probably isn't thinking about secondary legislation, but that does seem to be where a lot of the more prescriptive detail is going to end up sitting. I guess from our view, the current kind of healthy babies and best start for life provisions and services are often don't meet the needs of babies who've needed neonatal services when they're born. And I guess I'd be quite interested to know whether the First 1001 Days Foundation have started thinking ahead to what they would like to see within the secondary legislation, if you have any priorities, and if there's going to be an opportunity for wider organisations like us and others on this call to help shape that in consultation when the time comes around. Thank you.
Yeah, thank you. Both really great questions, and both doing such important work in so many ways. I think let's take both offline and have a sort of longer informed conversation about it. I think the challenge we've got at the moment is trying to keep the bill as simple as possible so we can get government support. And I think the biggest risk we've got down the line, and we've seen this with so many bills in the past, is they at committee stage become a bit like Christmas trees, as in there are lots of different things added to it, and all hugely worthy in their own right, but it just means that the Treasury then pulls the plug because the costs drift out of control, or it just drifts out of scope. I think the key is going to be getting the legislation over the line, so getting this to the point at which it becomes an act of Parliament, and we have that sign off from His Majesty the King. A lot of other things will naturally come later on the back of it, and that's why I'm just really keen that we're really strict with ourselves in terms of not overcomplicating it, but actually getting something on the statute book that we can then build on in the future. But I think let's see what's within the art of the possible and how far the government are pushable within the boundaries of just making sure that this is going to get, the key thing is getting this over the line and making sure that it does become an act of Parliament. Does that answer the questions?
That's helpful, thank you.
If I don't know if Sir Desmond is still on the call or would like to add any more, but I just want to say a huge thank you for all of your support and support of your organisations for this bill. Things are moving at pace and changing almost daily. Sir Desmond's office and we are in negotiations with the departments and government centrally. There's all change, which is frustrating because we might have to start again with some ministers and secretaries of state, but that's okay. We will do that work, and any and all support you can give us to amplify, to make sure that this is front and centre in parliamentarians' minds over summer recess, so they come back in September with babies on their minds and wanting to come back and support this bill. And if possible, getting them there on the 4th of September is going to be really, really, really critical. So anything you can do, please visit our website. The toolkit's all on there. If you've got any questions, please do fire them over to us. We will try our very best to answer them, and we look forward to working with you all as this bill progresses. We very much hope to become an act of Parliament with your support. So thank you very much.
I just wanted to add my thanks to all you and your organisations for the hugely important work that you're doing in this space. So thank you very much indeed.
Perfect. And I already left in the chat the website in case you need the template to reach to your local MP, to your network of supporters. Any support you can get us, that would be amazing for the bill. And I also I'm going to leave my email in the chat just in case you want to reach out and have a conversation offline. So thank you very much for coming. And yeah, hopefully see you very, very soon.